assurance that as soon as it happens, then you're going to get direct medical assistance.
That's very true. I think a lot of people got that text message. Anyone who was probably anyone who was registered on NHIF before. This is after the government had said they would not forcefully migrate anyone, right? And you were meant to sign up for the SHIF plan. But there's a lot going on. As you've said, there is no guarantee that once you've migrated to SHIF, you get medical service, because a lot of patients across the country are being told, quote, systems are down when they seek medical care and when they want to pay using their NHIF numbers or cards. For example, Esther, who had a surgery scheduled for a few days before yesterday, but because there's no functioning health insurance system, she's a prisoner of pain. She hasn't eaten for 2 days. They keep telling her she'll go into surgery, but nothing happens, and she's scared. She's a resident of Kisumu County, and she was scheduled for surgery on Tuesday. It is now Thursday, still no surgery, because again, there is no functioning insurance system.
And of course, she's trapped in a nightmarish reality shared by thousands of Kenyans stranded in hospitals due to a collapse of the SHA's systems. Across the country, patients like Esther are enduring a medical crisis of unspeakable horror, and SHA, which is now responsible for covering healthcare costs, is still a work in progress. So this transition was announced and immediately absorbed by the hospitals, but was not actually, it did not give the patients enough time. You know, there are patients with chronic illnesses. Others were actually scheduled for things like surgery. Others often go to the hospital daily for daily maintenance. And of course, they are fully dependent on NHIF, or rather funds from NHIF. Now imagine walking in the next day and you're told, sasa hapa hatuwezi ku-" You have to get money off your pocket. And you know the situation is right now. High cost of living, and most of the people are living hand to mouth, and it changes the situation for everyone.
Right. When you compound that with the fact that with NHIF, you will be paying more value, right? As far as your healthcare is concerned, then it definitely paints a picture for what the future of healthcare looks like. We've talked about it before. What you will get for your coverage and for the amount of money that's deducted from your salary is effectively less than what you are getting under NHIF. And there's so many people who, like you've said, rely on NHIF for treatment of, chronic illnesses, for just the occasional, popping into the hospital and finding out what's wrong. For maternity, there's so many mothers who are stranded in hospital. Baby is okay, but they can't go home.
They can't go home because they're being told that processing their documentation, or rather their registration has not yet gone through. That's the situation of public health in Kenya. What do you think about the stories we've just shared? Use the hashtag morningfix, tag me at Brian_Aseli
at Mariam Bishar.